So first we are going to finish our spleen. Then after that we will be coming back to our previous topic, right? Because we have to complete spleen and we have to complete the heart. But after completing the spleen, we will be coming back to lung, right? Lung, because liver is attacking over the lung and creating kapha with bleeding. That part is still remaining, right? So today let's finish the spleen. Then tomorrow we'll talking about the lung again. Spleen can be considered like a fountain, water, lifting everything up. And spleen is connected with worry, overthinking. If the person is worrying a lot, doing more overthinking, it will weaken the spleen. चिंता तनाव और ज्यादा सोचने से स्प्लीन कमजोर हो जाती है. If your spleen is good, then person will be very moral personality, right? I've seen the person having spleen personality. The person is having dominant earth element. They might be telling lie many times. Okay. They might be diplomatic. They might be having many faces, but still they are very moral. They are moral, right? They like morality. They try to follow morality, right? तो अगर कोई व्यक्ति अर्थ एलिमेंट वाला है, थोड़ा गोल मटोल होगा. अर्थ एलिमेंट मीन्स गैदरिंग ऑफ फैट, राइट? और डिप्लोमेटिक भी होगा, कभी कुछ बात कभी झूठ भी बोल सकता है, लेकिन फिर भी मोरलिटी उसके अंदर होगी. सो दिस इज कॉल्ड द क्वालिटी ऑफ स्प्लीन. ओके, spleen people are very trustworthy, very trustworthy due to their morality. Even as per the Ayurveda, if you compare as per the Ayurveda, there are three types of personality: Vata, Pitta, and Kapha. Vata people are very light because they made by air and ether. They are having dominant air and ether. Pitta people is the combination of fire and water. They might be very fiery sometimes, but on the same time, they are also very polite. The Kapha people is a combination of earth and water. And the Kapha people might be heavyweight. And we can see here earth element. Prithvi Tattva, earth element. So the Kapha people is highest loyal personality, highest loyal. जो कफा प्रकृति के लोग होते हैं, उनके अंदर जो लॉयल्टी होती है वो सबसे ज्यादा होती है. Then the question comes, suppose there are three persons, one very lean and thin, second one, this is the muscular person, muscular and very dynamic, sporty, and third person might be little overweight, obese person. So one 2 and 3. So tell me, who is Vata, who is Pitta, who is Kapha? Vata, Pitta, Kapha. कौन सा व्यक्ति वात डोमिनेंट है, कौन सा पित्ता डोमिनेंट है, कौन सा कफा डोमिनेंट है? Okay. So which is the Vata, which is Pitta, which is Kapha dominant? Kapha dominant personality are highly loyal personality, highly loyal. You know, now just by seeing the body, we can't declare, because there are two types of personality. One is body personality, another is mental personality. Many people are looking like Vata, but from the mind they are Kapha. Okay, so there might be, I've seen many persons, they are Kapha, but from the mind they are very, very hyperactive. So there might be two different personality. Body is different and mind is different, right? But the Kapha people, the person who is having more earth element, they are very moral personality, very loyal personality, very trustworthy personality. In the TCM, it has been told spleen is connected with the trust. If your spleen is good, you are a very trustworthy person. And if your spleen is weak, then we need to think about it. Even the, right, we need to think about it. तो अगर व्यक्ति की स्प्लीन अच्छी है तो बहुत ही ट्रस्टवर्थी व्यक्ति है, और स्प्लीन कमजोर है तो थोड़ा कम ट्रस्टवर्थी है. नाउ इफ वी सी एज पर this concept, the person is very lean and very thin, Vata personality might be little fluctuating person and might not be that much trustworthy. I will give you one example. One of my friend in the college, lean and thin, Vata personality, very lean, very thin, Vata personality, poor spleen. I told him, oh, hey, my friend, please listen this thing, please don't share to anyone. Okay. No sound. So I told him, please don't share this secret to anyone. I told to my friend who is Vata personality. What happened next day? Each and every person of the college was knowing that thing. This is not the good quality of this is not the quality of good doctor. Doctor should be having that power to keep secrets, not share here and there, right? So spleen people are very trustworthy. If your spleen is good, you are trustworthy. So this is the virtue of spleen. It's written in the TCM. This is the concept of TCM. So it's clearly mentioned. What mentioned? Trust is at its virtue of the spleen. Trust. Spleen is overburdened by sitting. I will focus more on sitting. Okay, definitely by standing also, but sitting is more predominant thing who is doing the weakening of the spleen. The meaning of sitting, when the person is doing the sitting job, sitting throughout the day, 8 hours, 12 hours, continuous sitting, weaken the spleen, right? अगर व्यक्ति बैठता है ज्यादा तो स्प्लीन कमजोर हो जाएगी, बैठे रहता है, right? Spleen is having connection with the dampness or the moisture. If there are too much moisture around, it will increase the dampness in your body. अगर आसपास ज्यादा moisture होगा, dampness होगी, cloudy atmosphere होगा, it will increase the dampness. You know, this is a very, very important factor, dampness. If the moisture around the cloudy weather, the moisture around dampness in the weather, this is a sign of a spleen, right? Like if the spleen is weak, then there will be too much dampness in the body. It will form too much dampness. And dampness will create swelling. And even the overweight, obesity. स्प्लीन कमजोर होगी तो डैम्पनेस हो जाएगी. तो जब बाहर डैम्पनेस होती है तो वो हमारे अंदर भी डैम्पनेस को बढ़ा सकती है. If the dampness outside, it might also create the dampness inside the body. That's why in the Ayurveda it's clearly mentioned. If the dampness around, don't do any detoxification treatment. Like in the Ayurveda, there are many treatments for cleansing purpose. Okay, you can give medicine, you can give herbs, but there are lots of detoxification treatment done in the Ayurveda. It's clearly written, see the cloud. If cloud is there, don't do any detoxification treatment that day. If the dampness around, don't do any detoxification treatment that day, because dampness around will increase the dampness inside. And the nature of dampness is equal to dullness. It will create dullness. The dull digestive fire, dull digestion, dull mind, dull body, everything become dull because of dampness. So dampness is the sign of spleen, right? Like you are living in the city. Many cities are having more dampness. So the people might suffer with the spleen weakness there. And spleen is manifesting on the lips. If there is a problem in the lips, so we have to work on the spleen. So few more things I would like to tell you here. I already discussed yesterday. Raw food is not good for spleen. If your spleen is stronger, you can enjoy the raw food. But if your spleen is weaker, take the steamed. Okay. And if you're taking the raw food, not able to digest, improve the spleen qi by this protocol. Then also I have discussed yesterday, if the person is not taking the food on the time, suppose sometime taking the dinner at the 8 p.m., next day taking on the 11 p.m., another day taking to the 12 p.m., some people might take 1 a.m. in the night, it will damage your spleen. If the person, even during the day, sometime you are taking the food at 11 a.m. in the morning, sometime you are taking the different timing. So even I can also tell irregular timing. It means suppose you are not feeling hungry, but if you are eating the food, that is irregular time. The right timing means you are hungry and eating the food. That is the right time. Right? You have taken the heavy breakfast in the morning. Okay. Now it is lunch time, but you are not hungry. It is not the right time. Please don't take lunch. If you overburden your digestive system, it will weaken your spleen, because excessive eating, unwanted eating will create weakness on the spleen. So if the person is having irregular food habits, so take the treatment of the spleen qi deficiency, because he will be suffering with the disease which is created by this spleen qi deficiency. Now the excessive eating also create the spleen qi deficiency, and spleen qi deficiency will create overweight or the obesity. Overweight is also the result of spleen qi deficiency, because spleen is connected with the fat metabolism. So overweight is also connected with the spleen. So if spleen is weak, person will be becoming overweight. Now I am coming to this point. If the person is not taking good diet, if the protein is not enough in the diet, protein is less in the diet, and if the person is having malnourishment, it will create the spleen Qi deficiency. So whether person overeat or whether person is not fully nourished, undernourished, not taking enough food, in the both condition, there will be spleen Qi deficiency. Then we need to use this protocol. Suppose this types of kid coming to you, we can see lean arm, lean legs, okay, and malnutrited. Then what to do? The treatment. We need to work on the spleen Qi deficiency with this protocol. And while eating while working, or eating and immediately after you're working will also do spleen Qi deficiency, need to treat by this protocol. We are worrying a lot, also doing overwork, workaholic nature will make your spleen weaker. Now we are coming to this point. If the person is living in the damp home or the cold weather, so there is an attack of dampness. So we have to expel the dampness. I already discussed yesterday, so I'm not going to discuss again. Now we have to discuss from this point. Before these, all the slides I already discussed yesterday. So those who have missed it can see the previous video. Now from this slide onward, I'm going to discuss new things. Now, spleen is responsible for holding everything, right? Even if you want to hold the blood, you can hold the blood in the blood vessels with the power of spleen. Spleen will hold the blood inside the blood vessel. स्प्लीन ही ब्लड को ब्लड वेसल में होल्ड करेगी. Now if spleen is weak, then not able to hold the blood, so person is having bleeding. If the bleeding is below the skin, then there will be black spots or the red spot. Sometimes what's happening, there is a disease that is called purpura. The meaning of purpura, there's a decreased platelet count, that is called purpura. So I would like to make you understand here. Look at here. In the blood we are having number one, plasma. Plasma means liquid. And number two, we are having blood cells. There are three types of blood cells: RBC, they are red; WBC, they are white; and the platelet. So RBC is responsible for bringing the oxygen. So we are getting the oxygen, we are getting the energy because of RBC. WBC are the fighter cell. They are giving defense and the protection. And the platelets are very much useful when there is a bleeding. So platelet are responsible for stopping the bleeding. Suppose there is a bleeding from certain parts. Suppose some blood vessel got ruptured, we got accident. So bleeding is happening from here. So platelet are gathering here and responsible for stopping the bleeding. So in our blood, there are platelet count should be more than 1.5 lakhs to the 4 lakhs. This is the normal platelet count found in the bloodstream. हमारे ब्लड में पाए जाने वाले प्लेटलेट का काउंट होता है 1.5 लाख से 4 lakhs. But suppose if the platelet are decreasing, why the platelet are decreasing? Suppose person is taking blood thinner like the aspirin, for example aspirin. Many persons suffering with the heart disease or the high blood pressure, they are taking regular blood thinner. So blood thinner means they are making blood thin, so they are reducing the platelet count. Sometimes platelet count becoming 1 lakh or less than 1 lakh, right? Then if the bleeding is happening from some part, suppose now bleeding is happening, so platelet will not able to act very fast, so there are more chance, more bleeding, right? Even there are some disease like the hemophilia, there are too much bleeding because there is a no formation of the plaque. Even some other disease like the dengue, in the dengue also there is a very fast decreasing of the platelet count. Whatever the reason, and if the platelet is decreasing, they will cause more bleeding. The bleeding might be very internal also, and sometimes this bleeding is not visible, and we just see very less hemoglobin because of the internal bleeding. So how to stop the bleeding? So now we are coming to this point. Why the bleeding is there? Because spleen is not able to hold the blood inside the blood vessel. Whatever the cause, whether the platelet are less or whatever the other cause. But as per the TCM, spleen is responsible. If spleen is good, automatically everything will become good. So let's strengthen the spleen. So number one, we are taking spleen 1 point, which is the wonderful point, which is called stop bleeding point. And number two, CV9, who is controlling the fluid metabolism. So let's see the 2 points first. So number one, there is a point spleen 1. Spleen 1 is stop bleeding point, whether the bleeding from piles, from blood vessels, from anywhere. If the bleeding, spleen 1 sedation will be stopping the bleeding. So we can see the feet here. We know from inner side, there's a liver meridian is passing. And from the other side, spleen meridian is passing. So if we look at the feet here, we can see this is the nail, just the corner of nail, this is the location of spleen 1. So this is the location of spleen. So we can put the magnet here and we can sedate the spleen 1 point here. We can put the magnet and we can sedate this point. This is the location of the spleen. Or we can put the needle and we can do the sedation. So whether we put the magnet or we put the needle here, any method, we can do the sedation of this point. I will show you this point in the feet. Look at this image. Spleen 1 sedation, one of the great point to arrest the bleeding. Many times the female is having too much menstrual bleeding, so we can reduce it with the help of spleen 1. Look at this point, spleen 1, right? This is the spleen 1 just on the corner of nail. This is the nail. And this is the spleen 1. Okay, so we can put this point violet. The second point will be CV9. CV9 is the very good point of fluid metabolism. So I will show you, this is the navel. Navel means CV8. If we go one tune up, that is CV9. Excellent point for fluid metabolism. तो CV9 और स्प्लीन 1 को लगाकर हम ब्लीडिंग को कम कर सकते हैं और फ्लूइड मेटाबॉलिज्म को नियमित बना सकते हैं. After that, now we will strengthen the spleen with the help of spleen 3, spleen 6, stomach 36, UV20 and CV12, already discussed in the previous class. So you can see the previous video for I've done all the demonstration. Now we have strengthened the spleen, but right now we want to work on the blood. So whenever we want to work on the blood, we have two very special point of the blood. One is spleen 10 and another is urinary bladder 17. We have to stimulate these 2 points, then this protocol will complete. Okay. हमें 2 पॉइंट यूज करने होंगे. इन दोनों पॉइंट के बिना हम ब्लड का कोई ट्रीटमेंट कंप्लीट नहीं कर सकते. ब्लड की जब भी बात आए, वेदर द ब्लीडिंग, वेदर द लो ब्लड, excessive blood stasis, blood stagnation, whatever the condition coming to the blood, we have to stimulate this point. We will be putting the star magnet, or we are putting the needle with the even method. But regarding that, I told you want to stop, arrest the bleeding, spleen 1 sedation, right? But you want to tonify the spleen, then other points should be tonified. Spleen 3, spleen 6, stomach 36, CV12, because we want to strengthen the spleen, right? All point we can do the even method. So now spleen 10 is the point found. Spleen 10 is the very, very special point of the blood. So look at here. So this is the knee. We can say this is the knee. And here is the muscle. If I do the straightening, I can feel the muscle here. This is the vastus medialis. So from the medial corner of the knee, if I go to chun, that is the location of spleen 10. Spleen 10. Spleen 10 will be here, right? This is spleen 10. On the middle corner, I'm going to chin up. From the middle corner, I'm going to chin up. I can feel the muscle here that is called vastus medialis, and this is spleen 10. This point is very not painful because we are having too much muscle here. So this point is not painful here. Look at here. Right? Spleen 10. Visible? Maybe I have to bring some colorful needle. I will do that. Okay. Fine. So spleen 10, and regarding the UV17. UV17 is can we locate it very easily? UV17. So let's see the location of UV17. All of you are aware because we have discussed this point many times, but at least I will tell you once again. So if you look at this image, let's see the location of UV17. UV17 is the wonderful point for blood because this is the influential point of blood. So if you look at this image, this is the scapula bone. If you draw the line, horizontal line, from the lower part of the scapula, if you draw the horizontal line from the lower part of the scapula, so from the spine, if you go 1.5 chun bilateral, that is the location of urinary bladder 17, one of the great point for blood. It is called influential point of the blood, right? इसे हम ब्लड का इन्फ्लुएंशियल पॉइंट कहते हैं. ये एक बहुत ही शानदार बिंदु है जो ब्लड की सारी केमिस्ट्री को इंप्रूव करता है. So we have seen this point, and another point, that is spleen 10. Spleen 10 point located in the feet. So look at here. From the medial corner of the knee, if you go 2 chin up, that is the location of spleen 10. We can see the vulgus muscle here that is called vastus medialis. That is the location of spleen 10. So in this way, how many points we have treated? हमने कितने पॉइंट्स के माध्यम से इसका इलाज किया? हमने देखा, we have seen here. We want to increase the platelet count. We want to arrest the bleeding. We want to work on the internal bleeding, spleen 1, CV9. Then strengthen the spleen, and finally add 2 points for blood. Right? So we can treat the internal bleeding or purpura, or we can also treat the low platelet count. Let's move ahead. अब हम आगे की बात करते हैं. So not only this, if spleen is weak, Bleeding might be from the stool, from the urine, from anywhere, from any part of the body. So this is called spleen is not controlling the blood. This is the diagnosis, right? This is the diagnosis. The protocol will remain same, but we have discussed shortly in the previous page. But remember one thing, if the bleeding is happening, definitely spleen is responsible, but sometimes some other organ also might be responsible. Maybe the stomach heat, it might create bleeding. Maybe heat in the small and the large intestine or the heart also might create bleeding. So definitely bleeding means spleen. Bleeding means spleen. But bleeding means spleen, but other part also might create bleeding. The question comes, which point increases the platelet? What we have discussed. All the point. Spleen not controlling the blood, that is the protocol to increase the platelet count. Same protocol. Okay. Fine. So the same protocol, bleeding from the anus, bleeding from the stool, bleeding from the piles, bleeding from the menstruation, excessive bleeding, same protocol will be useful. Now we are coming, sometime what's happening? When the spleen is becoming weaker and weaker, weaker, weaker and more weaker. So the first stage is called spleen Qi deficiency. Second stage is called spleen Qi sinking. Sinking means too much weak. And third stage is called spleen Qi collapse, means now permanently has collapsed, right? So when spleen Qi is deficient, but it is becoming more and more deficient, we are telling sinking of Qi. Like the varicose vein. Varicose vein coming in this category, varicose vein means spleen Qi sinking. That's why varicose vein is taking more time. Many patients are coming to us, can you treat the varicose vein? Yes, definitely, but it is going to take more time. वेरिकोज वेन को ठीक कर सकते हैं क्या? जी बिल्कुल कर सकते हैं, लेकिन अब ये स्प्लीन ची डेफिशिएंसी नहीं है, ये उसके की आगे की अवस्था है जिसे हम कहते हैं स्प्लीन ची सिंकिंग. So now it is going to take more time. And as we are doing the treatment of the spleen Qi sinking, there will be development of the valve inside the blood vessels, and slowly we can see the improvement in the varicose vein. It might take longer during time. So what is the treatment? Here, we need to strengthen the spleen with our previous protocol, spleen 3, spleen 6, CV12, stomach 36, UV 2021. It is the same treatment protocol. We will do moxa and we will do tonification. इस प्रोटोकॉल को हम मोक्सा भी करेंगे, हम टॉनिफिकेशन भी करेंगे अगर हमें स्प्लीन ची को इंप्रूव करना है. बट विद दैट we are adding 2 point governing vessel 1 and the governing vessel 20 and the stomach 21 to lift the chi up. इसके अलावा हम governing vessel के 2 पॉइंट यूज करेंगे. We are going to use governing vessel 1, so we can use in the sujok because governing vessel 1 is the point found in the tip of the tailbone. ये हमारे tailbone के टिप पर पाया जाता है. And the governing vessel 20 found in the head, and governing vessel 20 one of the great point to lift the chi up. Governing vessel 20 के माध्यम से हम ऊर्जाओं को ऊपर की ओर लिफ्ट कर सकते हैं. And the stomach 21 is the very good point helping in this condition. So let's see here, this is the point stomach 21 here. 90, 20, 20. So this is the point fortune up from the navel at the level of CV12. तो हमारा ये प्रोटोकॉल है, हमारा वही स्प्लीन वाला प्रोटोकॉल है, लेकिन अभी हमें इसमें मोक्सा करना होगा और मोक्सा के साथ हमें कुछ पॉइंट और भी ऐड करना होंगे, जैसे गवर्निंग वेसल 1 20 and stomach 21. We have to add few more points, right? Then we'll able to work on the sinking condition. So this is the treatment protocol of the varicose vein. Here, if you see, we have taken CV6. Here we have to, if we take CV6, CV12 and stomach 36. For the person suffering with a varicose vein, we can regularly do moxa on these 3 points to lift the chi up, to raise the yang up. हम इन 3 पॉइंट पर रेगुलर मॉक्सिवेशन कर सकते हैं उन लोगों के लिए जिनको वेरिकोज वेन की प्रॉब्लम है. Because these 3 points are one of the great point to lift the chi up. So how many varicose vein patients around? I think too much, too many, or not. Why the people suffering with the varicose vein? Because nowadays there is a standing kitchen. We are cooking in the kitchen in the standing. There is no sitting in the kitchen, right? So 2 hours female are spending, even might male, but more female are spending time in the kitchen just standing for many hours. So they are getting a spider vein, and we can see the dilated vein in the leg, and slowly they're becoming varicose vein, right? Moxa is wonderful. So after like at least twice a week, all the female who is sitting in the kitchen for many hours, twice a week do the moxivation for minimum 10 minutes on stomach 36, CV6 and CV12. Lie down, keep the one moxa stand on the CV12, one moxa stand in the CV6, and 2 moxa stand on the stomach 36. Then you will never suffer with the spleen qi sinking, right? तो कभी भी spleen qi sinking नहीं होगी. So this is the protocol prescription of the varicose vein. So what we have to do? We have to do the moxibustion on the CV6 here. CV6 will lift the yang chi up. We have to do the moxibustion on the CV12. Or if you don't want to do the moxibustion, okay, no problem. Just put the needle and tonify them, or do the even method, or put in the sujo. And the third point is stomach 36. Do the moxibustion on the stomach 36, the wonderful point. Okay, it will remove all the unwanted stagnation of the chi from the leg. ये पैरों में से रुकी ऊर्जा को पूरा निकाल देगा. So let's see here. So this is the protocol of the varicose vein. Let's move to the hernia. What is hernia? The meaning of hernia: when some structure is bulging out and breaking the boundary, moving somewhere. There are many types of hernia: inguinal hernia in the male, femoral hernia in the female, epigastric hernia, umbilical hernia, incisional hernia. What is the meaning of hernia? The meaning of hernia is when someone is reaching on the place where not allowed. Not allowed. That is hernia. hernia का मतलब है कि ऐसी जगह पहुंच जाना जहां allowed नहीं है. Right? That is hernia. What is happening? Suppose someone has done the surgery, right? Surgery is very common now, especially for the female and even with the male. Some male got accident and did the abdominal surgery, and female did cesarean and after stitches. But sometimes because of maybe some reason, some internal structure pushing the stitches and coming out. That is called incisional hernia. Right? We have seen sometimes umbilicus is coming out, umbilical hernia. Hernia means anything is going here. Sometimes stomach is pushing the food pipe and going upward and entering in the food pipe. That is cardiac hernia. Hernia means when anything is moving in the part where should not move. That is hernia. Right? So why hernia? As per the TCM, why the hernia is happening? Because spleen is not able to hold the organ at their own place. That is the reason of hernia. So 1 minute. So we need to work on the spleen. For any types of hernia, we need to work on the spleen, whether the umbilical hernia or any different type of hernia, we need to work on the spleen Qi sinking. Spleen Qi sinking. Right. So again, this is the prescription. Spleen 36, CV12, stomach 36, CV20, 21, tonification. And 3 point, governing vessel 1, governing vessel 20, stomach 21. They are lifting and raising the chi up. And here CV6, CV12, stomach 36 will improve overall chi. The same protocol what we have used in the previous slide. Is it clear? Anyone having any confusion regarding hernia? All of you are very much aware with the hernia. Hernia knows, no? Everyone know hernia. Right? We have to, in the sinking condition, see what is sinking. The meaning of sinking, already energy is very, very low. So we'll tonify all the points. In the deficient condition, on the sinking condition, we'll tonify all the points. Don't know hernia. Okay. Okay, I will tell you. Example. Just I'm giving one example. Look at here. So this is the, we are eating the food, then food is going in the mouth. Then food is coming in the food pipe. This is the food pipe or called esophagus. Then from the food pipe, food is going in the stomach. This is the stomach, right? Food is coming here. In the stomach, we know there too much acid, too much hydrochloric acid. If by chance, if this acid is going in the food pipe, it will start creating too much warning. So this food pipe is very tightly, having very tight door here, very, very tight door here. So acid cannot go upward. Okay. This door is called cardiac sphincter. This is the name of this door. Okay. Cardiac sphincter. But what happening? Sometimes person is eating too much acidic food, or person is drinking the alcohol, or taking something which is very acidic, and too much acid production in the stomach. So too much gaseous formation in the stomach. So this is pushing. So stomach is creating too much pressure upward. So what's happening sometime? The little part of the stomach. So this is the stomach. But the little part of the stomach is going inside, right? Inside. Now there is a very big problem. Why? So little part of the stomach is moving inside. It should not move because here is a sphincter. But the little part of the stomach is moved inside. Now there is a direct connection. Now acid and food pipe is in the direct connection. So when stomach is pushing the food pipe and moving inside, this is called hernia, cardiac hernia. Cardiac hernia, the person will be suffering with the acidity all the time, or called GERD. GERD. Gastro, esophageal, reflux disorder. All the time acidity, 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 because now there is a no door closing. GER. This is because of cardiac hernia. Got it? So this is the one example of hernia. Hernia means when someone is moving in the wrong direction, that is hernia. Now see, food pipe is tightly closed all the time. Food pipe is like a snack, right? If you're eating something, your food material is going from the part, only that part will be bulging up. Then as the food pipe is moving, then it will again collapse. So the food pipe is only bulging when the food particle is moving down. So there is no chances to acid cannot come upward. But if the cardiac hernia is there, it might common with the person eating too much spicy food, alcohol, and acidic food, and even worry create lots of acidity, tension, stress. So they suffer with the cardiac hernia. Like I will give another example. If we talk about the male, in the male, we know there is a testes, two testes. Okay, testes. Fine. In the testes, there are many structures. They are producing sperm, right? So testes are like this. Testes are like this. One testes and the another testes. They are having one pipeline like this. So they are connected with the pipeline here. But this pipeline is closed. Nothing can come down. Why the pipeline is there? Because when the fetus in the mother womb, that time the testes is coming from the abdomen to this part. That time testes is coming from the abdomen to this part. So there is a pipeline. But in the old days, what's happening? This becomes weaker. So the person is coughing. So coughing, so some part of the intestine is moving in this part. So that is called inguinal hernia. Inguinal hernia. What is inguinal hernia? Then little part of the intestine reaching in the inguinal canal. Because see, the pipeline is there. Why the pipeline there? In many other animals, testes is not coming down. Testes remains in the abdomen. But in the human, it's coming down. Why? Because someday what's happened? It's coming down only with the purpose to reduce the temperature. Because in the low temperature, there is a good formation of the sperm. If the testes remain in the abdomen, there is a high temperature. It's coming down, so it will be coming in the contact of surrounding, there is a low temperature. So that's why there is a procedure. During the development of the infant, during the development of the fetus, then testes is coming out, descending down. Many times when kids is taking birth, testes are not descending down. Then parents are in the worry what to do. Testes still not came down. Okay. In the old age, this part will become very weaker. This membrane will become weaker. So when the old person coughing a lot, then intestine is moving, pushing the membrane of the testes. So that is called inguinal hernia, which is common with the male. That's why we're telling, do not lift the weight. Okay, if someone is lifting the weight in the wrong way, even it might create hernia. Got it? Hernia, what is hernia? Hernia means anything which is going in the direction we're not allowed. That is hernia, right? So same thing happening at the different body places. So it is called inguinal hernia, incisional hernia, femoral hernia. There are too many types of hernia. It's written here. Like we discuss epigastric hernia, means what we discuss, that cardiac hernia. And this umbilical is coming out, that is umbilical hernia. I just told you about the inguinal hernia, then the femoral hernia, incisional hernia. There are many types of hernia. So in the hernia also we need to work on the spleen Qi sinking. The same protocol will be used. Now let's talk about the another condition. When the person is suffering with the piles and the hemorrhoid, and there might be bleeding piles, and there might be non-bleeding piles. In the piles, we can see there is inflamed veins. In the hemorrhoid, we can see there is inflamed veins, swollen veins. Sometimes they are bleeding. Okay. If because what is vein? What is vein? The vein should pump the blood toward the heart for purification or not? Yes. But vein is not able to do that. So blood is hanging down. Vein is becoming heavy. Unwanted deposition of the impure blood. Sometime little purification. Sometime partial purification. Partial blood is going up, but not whole the blood. Then sometimes bursting out, bleeding starts, bleeding piles. Where spleen, why the spleen is not sending the blood above? That's why spleen 5 is the very good point for hemorrhoid, spleen 5. But if you want to work on the spleen, if you want to work on the hemorrhoid, if you want to work on the piles, treat the spleen. So this is also spleen deficiency, or we can tell it the severe deficiency of the spleen, spleen Qi sinking. Same protocol we have to use, spleen 3-6, CV12, stomach 36, CV 20-21, governing vessel 120, stomach 21. So we have to improve the spleen, we have to raise and lift the Qi, right? And we keep on do the moxibustion on these 3 points. Then your spleen will be strengthened, stronger. This is the treatment of piles and hemorrhoid, right? And there is one very different condition. It also happened with many females, that is called vaginal prolapse. Vagina is coming out, right? Even sometimes rectum is coming out. Rectal prolapse, vaginal prolapse, uterine prolapse. This is a very prolapse condition. Because when the body is not able to hold the organ, this is the responsibility of the spleen, whether the organ, whether the blood, this is responsibility goes to the spleen. So this is also a spleen Qi sinking. Use the same protocol, spleen 3-6, CV12, stomach 36, UV 20-21, and raise the Qi by these 3 points. Do the regular moxibustion on these 3 points. And even in this condition, we can do the moxibustion on the governing vessel 20 on the top of the head. The same protocol for the rectal prolapse or the vaginal prolapse, right? When the person is telling, oh, I'm not hungry, I'm not at all hungry, okay, this, and the person is getting diarrhea. If the person is suffering with the abdominal fullness, bloating, nausea, there's a sign of spleen. Remember one thing, nausea is the very famous sign of the spleen. This is called aromatic behavior of the spleen. Aromatic behavior. What is the meaning of aromatic behavior? We are not eating anything. Just by looking something, ah, 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 that is nausea. This is spleen deficiency. You're looking something and feeling nausea. Sometimes it happens. You look something and you start feeling nausea. That is spleen. Because spleen is connected. You're not only looking something, but you are having some feel or maybe some smell. So that is called aromatic behavior, right? That is also spleen. So if the person is having nausea all the time, treat the spleen. Even during the pregnancy, many female is getting nausea. That is due to spleen deficiency, right? That is natural. But many other female, when they are traveling, immediately they start travel, they start feeling nausea. So nausea is the characteristic of spleen. If the person is telling, I'm feeling abdominal fullness, I've taken only one chapati, and even I'm feeling abdominal fullness, this is the spleen, bloating, diarrhea, and no hunger, this is the spleen. We have to treat this with the same protocol we have discussed earlier. So no hunger, diarrhea. Sometimes what's happening, no hungry, not hungry, and the diarrhea, right? But the hand and feet become cold. Now this is not only the spleen Qi deficiency, but now the person has reached to the spleen yang deficiency. Body has become cold. The protocol will remain same. There is no change, but we have to do moksha on all the points. What is the difference between spleen Qi deficiency and spleen yang deficiency? The difference is this: in the yang deficiency, person feeling cold, right? This is the more advanced condition. If you don't treat this, then person will collapse, right? First body will become deficient, then body will become cold, then body will be collapsing down. So no hunger. And the fall smell, what is the fall smell? Fall smell means the attack of dampness and the heat, damp heat over the spleen. That is the fall smell, right? So fall smell diarrhea, that is called the damp heat attack over the spleen, or sometimes we also tell it food poisoning. What is food poisoning? The meaning of food poisoning, the damp heat attacking over the spleen, that is food poisoning. How the damp heat attack on the spleen? You are eating the food, stale food. Okay, you are eating the stale food. Why we are throwing out the stale food? You are not eating the food now. Like you have cooked the vegetable today, you will eat after 2 days. No. Why? If you eat it, it might create food poisoning. There are lots of pathogen. There are lots of bacteria, virus will be taking birth in within 2 days, right? There is a different thing. Many person are keeping in the refrigerator, then they are using. But if you are not keeping in the refrigerator, then you can't eat, because even the vegetable will be smelling. Okay. It happened with me. I have given this story many times. I went for one workshop somewhere, not my workshop. I was doing job that time many years back, and I was searching. I was in the Ludhiana, and I was searching the food. So everywhere written murge, 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 Anil murge, Durge murge, murge. I was searching some vegetarian food. I went to some hotel. Then I ordered the vegetable, and they gave me some. They gave me food like it was looking very good and food like hot food. But as soon as at the last I took 1 spoon rice, it was stale. I told what? Oh, then they told me sorry. Then I came back, I finished my all the patient, I got damp heat attack. Why the dampness? Stale food creating the dampness, heat attack over the spleen, and I got food poisoning. I was looking one patient, then running for the washroom, then two patients, then running for the washroom, then one patient running for the washroom, fever, then no patient, then was lying down for 30 minutes, then again patient getting up, looking the patient, for the very dangerous. Okay. Even if we got the attack of dampness, we don't like air condition. We don't like anything. We don't want to eat. So damp heat attack is very common if you taken the food, stale food. Definitely in our home we will not eat, but outside we don't know. People are doing business and they might serve something which is not favorable for us, right? Sometimes when we are eating many different food, the people are keeping them in the refrigerator, but still they become stale, and we are getting many different diseases, right? So make sure that if the damp heat attacking over the spleen, it will create what? It will create foul smelling stool, fever, body pain, right? And stool will be sticky. Definitely dampness will create sticky stool. So in this condition, what we have to do now, we have to remove the dampness. We have to work on the dampness. So here we will remove the dampness with the spleen 6, spleen 9. We will clear the spleen area and the gallbladder area with the help of governing vessel line. This is a very good point to clearing the unwanted dampness. Li4, Li11 for reducing the heat. So they will reduce heat. They will reduce the dampness. Okay. And we can use governing vessel 14 to reduce fever. If we are feeling feverish, we can take governing vessel 14. And UV 2020 and CV12 for strengthen the spleen. But when we are having fever, we never tonify any point. So we can do even method. And in this condition, gallbladder 34 is also a helpful point, because ultimately this is a point of gallbladder, right? So this is a very good protocol. We can use it during the damp heat attack over the spleen. So this is the discussion of spleen. This was the discussion of spleen. I think I have to spend a little more time. So for the spleen, so now I have discussed most of the thing, but little bit discussion left about the spleen. So now we'll continue the discussion tomorrow. But tomorrow class will be for only advanced ECM participant, because most of the discussion we have completed. Now tomorrow we are discussing with our same ID which we are using for the advanced ECM class. Then after finishing the spleen, which is little left, maybe 30 minutes, then we'll continue the discussion of the different pattern of cough, right? Okay, so done for today. Yes, Monica ji. Yes, please.
Good evening, sir.
Very
Sir,
good.
in this, can naval moxa will work or not?
Yes.
In damp heat condition.
In the fever, we don't do moxa.
Okay.
In
अगर fever नहीं है,
It
only
will,
food poisoning है.
it will work very fast. No, no. Food poisoning means heat will be there.
हाँ, तो heat है तो.
Poisoning, heat and fever will be there.
अच्छा.
If
Okay, sir.
if fever is not there, then it's not poisoning, right? Okay,
Okay.
it's a dampness. But poisoning is, poison means aggressiveness, right?
हाँ.
In that way, right?
Okay, जी. Thank you, sir.
Welcome. Yes, Mr. 123. हाँ.
जी sir, can both leg are like a हाथी पैर?
Elephantiasis. Right?
Yeah.
Yeah. That is
Sir,
also damp. Yeah.
all-
That is also a damp attack.
Okay.
Damp. Okay. We have discussed this condition in some video, some previous classes. That is a detail because the hathi paw or the elephantiasis.
Yes.
That is a toxic dampness attack, right? We have to work on the dampness. For removing the dampness, we are taking spleen 3, spleen 6, spleen 9 sedation, right? Then also we are, maybe I will discuss this thing in the detail in some class because it need little more time, right? Okay, but that is the definitely dampness attack. As per our TCM, that is dampness attack. But elephantiasis is more difficult to treat than the normal dampness. So we have to work very properly for that. We have to stimulate many points. We will discussing sometime. Okay.
Okay.
Yeah.
Thank you, sir.
Welcome. Anjali ji.
सर अगर मान लीजिए स्मेल नहीं आ रही है तो
क्या नहीं आ
कोई
रही?
भी स्मेल नहीं आ रही है.
स्मेल नहीं आ रही तो गर्मी नहीं है. स्मेल गर्मी से आती है. Like see the smell. Okay, fall smell की बात कर रहे हैं.
नहीं फाउल नहीं, नो स्मेल.
Okay, so smell is the sign of heat. Smell from the urine, that is heat. Smell from the stool, that is heat. Okay, smell is the sign of heat in this way, right? किसी के पास जो हाँ.
ट्रीटमेंट फिर किस चीज का करेंगे? मतलब अगर किसी को स्मेल नहीं आ रही है.
If only the stool is sticky, it is a sign of dampness, right? So just we will do the treatment of dampness only, like spleen 6 sedation, spleen 9 sedation.
मेरा क्वेश्चन ये है कि अगर किसी पर्सन को कोई भी स्मेल नहीं आ,
अच्छा, उसको स्मेल नहीं है, पर्सन को स्मेल नहीं है.
हाँ.
Got it. Actually, smell is the different thing because spleen is connected with the chest. Smell is connected with the lungs, right?
Okay.
That is a different lung.
लंग्स से.
हाँ. स्प्लीन का कनेक्शन स्वाद से है, टेस्ट से. एंड लंग का संबंध है स्मेल से, राइट? If suppose we have seen the COVID, in the COVID many person lost the smell. Why? Because so that is called, we have discussed during the we have discussed the three things. Number one, prevention from the COVID. Number two, the treatment during the COVID. Number two, the treatment post-COVID. In the post-COVID treatment, we have discussed the complication like the myalgia, muscle pain, and loss of smell. So loss of smell is a sign of lung yin deficiency. So you need to do lung yin deficiency, right?
Yes, sir. Thank you, sir.
Yes, Madhubala ji.
गुड इवनिंग सर.
Very good evening.
सर ये जो है आपने स्वेलिंग एंड वाटर रिटेंशन के लिए बताया था, स्प्लीन 9, सिविन 9, स्टमक 28 एंड यूबी 22. तो ये सर सडेशन होंगे
जी,
सभी सडेशन.
जब भी हमें स्वेलिंग को कम करना है,
हाँ जी,
तो ये चारों पॉइंट को हम सेडेट करेंगे. सेडेट करने से, सेडेट विद द मीनिंग ऑफ सेडेशन दैट वी वांट टू एक्सपेल समथिंग आउट, दैट इज द मीनिंग ऑफ सेडेशन.
यस सर.
राइट?
हाँ सर. सर एक चीज और है, जो कोविड वैक्सीन जो ली गई उससे स्किन पे, एक मेरे नेबर हैं, उनके स्किन पे रेड रेशेज आते हैं और उसके बाद वो वाइट स्पॉट में चेंज हो जाते हैं सर. फिर वो
varicose-
जाते हैं, लेकिन बहुत टाइम के बाद जाते हैं, 3-4 महीने के बाद, जब तक नए बहुत सारे आ जाते हैं, पूरी स्किन उसकी वो चितकबरी होती है ना सर, इस टाइप से हो गई है। तो ये क्या है सर?
एक्चुअली क्या होता है कि ये तो वैक्सीन में ही लिखा रहता है कि वैक्सीन में क्या है ना कि कुछ परसेंटेज उसके साइड इफेक्ट होते हैं, है ना। कुछ उसके कहते हैं ना मोर्टेलिटी, व्हाट इज द मीनिंग ऑफ मोर्टेलिटी रेट? द मोर्टेलिटी रेट का मतलब है कि किसी ने कहा कि अगर 5% मोर्टेलिटी रेट है, इसका मतलब है कि 100 लोग को वैक्सीन लगेगी तो 5 लोग मर जाएंगे, इसका मतलब है मोर्टेलिटी रेट, राइट। फिर आती है साइड इफेक्ट की बात। साइड इफेक्ट की बात है कि वैक्सीन खुद भी तो वायरस है, लेकिन वो एक लो स्ट्रीम वायरस है। So many person they are having poor immunity, so this virus also create some irritability to them. तो आपको थोड़ा सा इम्यून सिस्टम पर उनके काम करिए, थोड़ा सा बिंड को एक्सपेल करिए, बिकॉज अल्टीमेटली कोविड वैक्सीन इज ऑल्सो वायरस, राइट।
हाँ सर।
हमने लिया, आपने लिया, कुछ नहीं हुआ क्योंकि हमारी इम्यूनिटी स्ट्रांग है और हमने फाइट कर लिया उससे, राइट।
हाँ जी।
लेकिन कुछ लोग स्ट्रगल कर रहे हैं, है ना।
हाँ जी।
तो उनके शरीर में से बिंड को एक्सपेल करिए, बिंड को
Wind- सर
बिंड को
थोड़ा
एक्सपेल
सा
करिए। अब आपने कहा कि उनको क्या होता है कि पहले उनको क्या होता है, आपने क्या कहा क्या होता है?
लाल लाल दाने आते
हाँ,
हैं।
तो अब लाल हीट है तो बिंड हीट को एक्सपेल करना पड़ेगा।
विंड हीट।
बिंड हीट को एक्सपेल करना होगा। बिंड को कैसे एक्सपेल करेंगे? यूवी 12 30, गवर्निंग वेसल 16,
हाँ जी।
गॉल ब्लैडर 20 एंड
गोल ब्लैडर 20। हाँ।
गवर्निंग वेसल 20। ओके,
हाँ
ये तो
जी।
बिंड हो गया। अब हम हीट को कैसे एक्सपेल करेंगे? LI11,
हाँ
LI,
सर।
चलिए दो एक भी पॉइंट अगर हमने लिया LI11, देन वी विल एबल टू। अब स्किन में हो रहा है तो लंग का भी हीट पॉइंट सेडेट कर दो, लंग 10 सेडेशन, राइट।
हाँ सर। तो ये सभी इनका
इतना
सारे
किया। अब इतना तो हमने बिंड को एक्सपेल कर दिया, हीट को एक्सपेल कर दिया। अब ये तो बिंड हीट को एक्सपेल करना है हमें इसमें मेनली, और थोड़ा सा उनके जो बैक्सू पॉइंट है, लाइक जैसे बैक्सू पॉइंट को भी हमने आपको बताया UV 12 13 पर गुआशा करिए थोड़ा।
हाँ जी।
So with the help of this, you will able to expel wind, heat, and you will see the, and see, this is one type of allergic condition, right?
यस
So
सर।
take the allergy point, spleen 10 and UV 17. Done, over.
स्प्लीन 10 एंड
Spleen 10 and urinary bladder 17.
17।
Done. So
सर ये
spleen 10 is the anti-allergic point or the blood point, and UV 17 also working on the blood because he is getting red rashes on the skin. That is, अगर आप उसको देखें ऐसे क्यों होता है, हमारे ब्लड में ये इओसिनोफिल और ये सभी काउंट बढ़ जाते हैं, राइट। तो वो
हाँ सर।
स्किन पर रेसेस आते हैं, IG, कई सारी चीजें बढ़ जाती हैं। तो दैट इज द प्रॉब्लम ऑफ ब्लड। सो दैट्स व्हाई वी आर एडिंग 2 पॉइंट्स ऑफ द ब्लड, सेडेट ऑल।
सेडेट ऑल सर।
या, और अगर उनको थोड़ा सा आयुर्वेद देना हो तो गिलोय की गोलियां खिलाइए। गिलोय और द टिनोस्पोरा कॉर्डिफोलिया इज वन ऑफ द ग्रेट मेडिसिन फॉर ये सर्टेन साइड इफेक्ट्स वगैरह इनके।
ग्लोए प्लस सर।
बस गिलोय,
ओनली ग्लो। सर डोज क्या दूं इनको ग्लोए की?
गिलोय की अगर गोलियां देना है तो 2 सुबह शाम।
2 सुबह शाम।
हाँ, इट्स अ वंडरफुल मेडिसिन।
ठीक है। थैंक यू सर। एंड सर तुलिका की रिपोर्ट देखी आपने सर?
नहीं देखी, मैं देख लूंगा फ्राइडे को देख लूंगा।
ठीक है सर, मैं फ्राइडे को कॉल करूँ, टाइम बता
करना।
दीजिए। टाइम बता दीजिए।
टाइम करिएगा फ्राइडे को 12:59 पे, 12:59।
ठीक है सर। थैंक यू सर।
ओके, चलिए।
ठीक है सर, थैंक यू सर।
ओके सरबजीत जी।
सर डायरिया और वाटरी स्टूल जो इनमें तो डिफरेंस होगा ही ना। वाटरी स्टूल इज कंटिन्यूस, तो इसमें कौन सी टाइप की स्प्लीन है? कोलैप्स?
यस यस। तो क्या होता है कि स्प्लीन जितनी वीक होगी स्टूल उतना ज्यादा वाटरी हो जाएगा।
अनकंट्रोल वॉमिटिंग, डायरिया, मतलब
See,
ऐसे ही दो।
spleen, if spleen little weak, then it will create diarrhea. But
Yeah.
spleen is too weak, it will create a watery diarrhea. Watery diarrhea. Because
उसका point,
पावर ही खत्म हो गई उसकी।
यस,
कुछ भी होल्ड करने की, फूड ची बनाने की पावर ही खत्म हो गई है। So it will create watery diarrhea.
तो इसका प्रोटोकॉल क्या होगा?
Same, we have to strengthen the spleen.
सेम।
And the
अच्छा,
best thing, we do the moxibustion around navel.
या दैट वाज वेरी गुड।
That is best protocol. Yeah.
एंड GB34 व्हाट वाज इट्स रोल, लाइक आप ये था ना GB34 आपने कहा था।
हाँ, GB34 इज अ वेरी गुड पॉइंट फॉर गॉल ब्लैडर ऑल्सो। ओके, इसका गॉल ब्लैडर का डिस्टल पॉइंट है GB34। तो जब भी कहता फॉल स्मेल वाला कुछ भी होता है ना, whenever
हाँ,
there is food poisoning, fall smelling something, there is attack of some heat, तो उसमें फॉल स्मेल का संबंध लिवर गॉल ब्लैडर से भी होता है। तो GB34 वर्क वेरी नाइसली फॉर दैट।
और GB9
Governing vessel 9 is one of the great point to clear the gallbladder, to clear the liver, to clear the spleen. जो मिडिल वार्मर है ना,
हाँ,
मिडिल वार्मर में से गंदगी और टर्बिडिटी को निकालने के लिए गवर्निंग वेसल 9 इज वन ऑफ द ग्रेट पॉइंट।
ओके,
आप देखेंगे मिडिल वार्मर में ही आता है वो बीच में, जैसे नीचे गवर्निंग वेसल 4 आता है, ऊपर हार्ट के लेवल पर गवर्निंग वेसल 11 आता है। आप नीचे आएंगे ना, जैसे स्केपुला के बॉर्डर के आसपास आपको गवर्निंग वेसल 9 मिलेगा। सो गवर्निंग वेसल 9 इज डूइंग द क्लियरिंग फ्रॉम होल मिडिल पार्ट, whether
But-
the liver or the gallbladder or the spleen or the stomach, and special clearing of gallbladder।
लेकिन स्प्लीन का ज्यादा रोल रहेगा ना।
हाँ, मतलब चारों की करता है, लेकिन हम गॉलब्लैडर की तो जबरदस्त करता है क्लीन।
ओके, थैंक यू।
जैसे आगे चल के कभी आपको कोई गॉलब्लैडर का पैटर्न बनाना हो, उसकी क्लींजिंग करना हो, गॉल स्टोन का पैटर्न बनाना हो, तो गवर्निंग वेसल 9 को मत भूलिएगा। ओके, या
थैंक यू सर।
वेलकम जी। ओके, सुरेंद्र जी, सुरेंद्र अरोड़ा जी। सुरेंद्र अरोड़ा जी, आपकी आवाज नहीं आ रही है। किसी को आ रही है आवाज? नहीं आ रही है। आप ट्राई करिए जब तक हम। सुधा जी, सुधा जी।
हेलो सर।
हेलो सुधा जी।
हाँ सर, मेरे को ये पूछना था, ये लाइपोमा जो नॉट्स जैसे होता है हाथ में, वो स्प्लीन का ही इसमें आता है कैटेगरी?
लाइपोमा इज नो, या आप इसे इनडायरेक्टली स्प्लीन से देखिए। स्प्लीन का काम है डैम्पनेस का निर्माण करना, ठीक है जी। डैम्पनेस, डैम्पनेस दो प्रकार की होती है। एक होती है भारी भरकम, जिसका
ओके सर।
नेचर है नीचे की ओर जाना, राइट।
हाँ हाँ,
एक होता है फ्लैम।
ओके सर।
वो भी डैम्पनेस सुनते हैं तो फ्लैम और डैम्पनेस एक ही लगते हैं, लेकिन
हाँ
फ्लैम अलग है। फ्लैम भारी होता है, लेकिन उसमें वजन नहीं होता। जैसे भूत, भूत को सुना जानते हैं आप? घोस्ट।
हाँ हाँ सर।
घोस्ट को हमने देखा नहीं है, लेकिन घोस्ट के बारे में सुना बहुत है।
सुना है,
घोस्ट
सुना
है ना,
है।
कुछ भी घोस्ट किसी की छाती पे बैठ जाता है तो लगता है कि बहुत वजन आ गया, या घोस्ट दिखता नहीं है लेकिन कुछ भी बड़ी चीज उठा लेता है ना। जैसे वो चंद्रमुखी में उसने पूरा पलंग उठा दिया था एक हाथ से, चंद्रमुखी ने। तो घोस्ट क्या होता है ना, घोस्ट इज इनविजिबल बट स्टिल वेरी पावरफुल। तो फ्लेम क्या होता है कि फ्लेम दिखता नहीं है लेकिन बड़ा पावरफुल होता है। सो लाइक फॉर एग्जाम्पल, आपकी किसी से लड़ाई हो गई, झगड़ा हो गया, वाद विवाद हो गया, और आप बोल रहे यार मुझे अच्छा नहीं लग रहा है, वो क्या है? वो फ्लेम है। ओके, दिखेगा नहीं लेकिन वो फ्लेम है। सो व्हेन दिस फ्लेम इज मूविंग इन द मेरिडियन, दिस क्रिएट लाइपो। गॉट इट?
ओके
ओके, सो फ्लेम मीन्स कि दिख नहीं रहा है लेकिन तब भी उसका अस्तित्व है। तो लाइपोमा मीन्स फ्लेम इन द मेरिडियन। सो यू हैव टू वर्क ऑन द, बिकॉज इसका प्रोटोकॉल हमने ऑलरेडी टेटाइज में डिस्कस किया था। इसका प्रोटोकॉल अगर ऐसा होगा, वी विल डिस्कस सम टाइम, बट दिस इज द कंडीशन which is definitely connected with the spleen, but
ओके
not the dampness, it is the phlegm, right?
ओके सर। हाँ सर, एक मेरी एक फ्रेंड को ऐसा नेक के ऊपर ऐसा बड़ा लंप आता है ना सर, वैसा लंप आया हुआ था। तो इट वाज पेनिंग उसको, जब बहुत ज्यादा पेन था तो तभी मैंने उसके ऊपर मोक्षा किया। बट मोक्षा करने से उसको पेन चला गया, बट वो लंप नहीं गया, लंप वैसे ही है ये।
जी एक्चुअली क्या होगा कि जो लाइपोमा होता है वो पेनलेस होते हैं। लाइपोमा में पेन नहीं होता, ये अलग
पेन,
होगा। ये जो है ना, ये
हाँ
सिस्ट या लंप हो सकता है और इसका पेन चला गया, राइट। लेकिन अभी
हाँ सर।
तो मतलब आपने, जैसे आपने मोक्षा किया तो
हाँ सर।
कोल्डनेस आपने उसकी हटा दी, राइट।
हाँ सर।
कोल्डनेस हटा दी तो वो चला गया। अब थोड़ा वहां पर डैम्पनेस पे काम करिए। दिस माइट बी कोल्ड डैम्प।
ओके सर।
देखिए कई कारण हो सकते हैं। जैसे उदाहरण के लिए किसी मेरिडियन में कोई ब्लॉकेज अगर है तो उसके रास्ते में कहीं भी लंप बन सकता है। उस तो आप देखिए कि कौन सा मेरिडियन निकल रहा है। जैसे उदाहरण के लिए अगर लंप यूरिनरी ब्लडर मेरिडियन में बना है, ठीक है, फॉर एग्जाम्पल,
हाँ, ओके
तो आप क्या करिए, यूरिनरी ब्लडर मेरिडियन की सफाई कर दीजिए लूस ऑक्सी से। लूस ऑक्सी मींस
ओके
लियो
सर
पॉइंट ऑफ द यूरिनरी
लियो
ब्लडर
पॉइंट
मेरिडियन, सोर्स पॉइंट ऑफ द यूरिनरी ब्लडर मेरिडियन एंड द जी क्लेफ्ट ऑफ द यूरिनरी ब्लडर मेरिडियन, तीनों को या तो सेडेट कर दें या इवन मेथड कर दें।
ओके सर
तो कहीं भी लंप है आप ये तो कर ही सकते हैं, उस लंप किस एरिया में आ रहा है, किस मेरिडियन में पड़ रहा है, उस पर उपस्थित आप मेरिडियन के लूस ऑक्सी पॉइंट से उस मेरिडियन की क्लियरिंग कर दीजिए।
ठीक है सर
जी
ओके थैंक यू सो मच सर
जी
थैंक यू
जी। ममता कालरा जी।
हेलो सर।
हेलो ममता जी।
सर मेरे ना बेटे के माउथ से बड़ी फाउल स्मेल आती है, तो उसके लिए स्प्लीन की का ट्रीटमेंट दे सकते हैं?
हाँ जी हाँ जी, मेरे एक फ्रेंड के घर में खाना खाने गया था, उसकी
जी
मम्मी बहुत अच्छा खाना बनाती थी, बढ़िया मस्त, वो एकदम इतना मस्त खाना बनाती थी। सुबह चाय, कितनी चाय, ये जो गिलास है ना इसकी डबल चाय। तो मैंने कहा इतनी
जी
तो मैं नहीं पीऊंगा, तो उसने कहा हमारे घर में तो पीनी पड़ेगी, नियम है, इसकी डबल चाय। अच्छा, सुबह उठते ही फिर फ्रेश होने के बाद, नहा के बाद वो चाय अलग है ना, वो तो अलग चाय। फिर खाने के साथ इतनी सारी नमकीन फरसान, कि यार हम फरसान घर पर ही बनाते हैं और सच में खाना इतना टेस्टी जबरदस्त। तो हमने देखा है कि जो लोग बहुत ज्यादा टेस्टी खाना बनाते हैं उनके घर में आप बहुत टेस्टी खाना बनाती हैं क्या?
जी बोलते हैं तो। जी
अच्छा, तो क्या है इसका कारण है? स्टमक हीट। क्या कारण है? स्टमक हीट।
स्टमक हीट।
बस
ओके
स्टमक हीट का ट्रीटमेंट करिए। और क्या है कि खाने में थोड़ा सा फ्रूट्स ज्यादा शामिल करिए, राइट? क्योंकि मैंने तो देखा मेरे फ्रेंड के मुंह से इतनी स्मेल आती है कि मेरा मन नहीं था मैं उसके घर जाऊं, लेकिन उसने इतने प्यार से मुझे आंखों में वो प्यार भरी नजरों से उसने बोला, मुझे जाना पड़ा उसके घर, है ना। मैं गया
जी
और उसने खूब खिलाया पिलाया, है ना। और
जी
तो क्या होगा कि खाने के साथ, जैसे कई बार हम क्या करते हैं, खाना भी खा रहे हैं और नमकीन भी खा रहे हैं, थोड़ा सा
जी
चेबड़ा चेबड़ा भी खा रहे हैं, है ना, और
हम्म।
चाय। तो क्या हो रहा है कि हम बहुत सारी ऐसी चीजें खा रहे हैं जिससे हमारे पेट में गर्मी बढ़ रही है, राइट।
जी जी
इसका
जी जी
सबसे बेहतरीन उपाय है कि आप पहले तो स्टमक हीट का इलाज करिए। स्टमक हीट
जी
को कम करिए, स्टमक 21, 44, 45 सेडेशन, है ना। इसके अलावा CB12, UB20, 21 सेडेशन, इससे
जी
स्टमक हीट कम करिए। और खाने पीने में थोड़ा सा सिर्फ 3 मील दीजिए, ब्रेकफास्ट लंच और डिनर, बीच में कुछ मत खिलाइए। और जो भी चीजें जैसे चाय वगैरह थोड़ा कम कर दीजिए। और जो ऊपर की चीजें नमकीन फरसान जो स्नैक्स हैं वो कम कर
जी
दीजिए। फ्रूट ज्यादा खिलाइए। और अगर थोड़ा जल्दी ठीक करना है तो सुबह का जो पहला मील है वो सिर्फ फ्रूट कर दीजिए, ओनली फ्रूट। बाकी लंच
जी
आप जो बनाती है वो दीजिए, डिनर आप जो बनाती दीजिए, लेकिन बहुत सारी चीजें मिक्स मत करिए एक साथ,
ठीक सर।
है ना।
राइट सर। सर जैसे उसके हाथों पे वो टिकते नहीं है, तो उसके लिए LU7 और K7 को सेडेट करें, वो मैग्नेट्स
बस
स्टे नहीं
पसीना ज्यादा
करते।
आता है, पसीना।
जी जी पैरों में भी आता है और हाथों में
तो
भी।
पहले सबसे पहले आपको क्या करना होगा कि पसीना कम करना होगा। पसीना कम करने के लिए हार्ट 6 और किडनी 7 को पहले आप बस मैग्नेट लगा दीजिए। हार्ट 6 और किडनी 7,
हार्ट 6 और किडनी 7 को सेडेट कर दें।
मतलब आप सिर्फ इवन मेथड कर दीजिए
इवन मेथड, ठीक है
और
सर।
थोड़ी देर में पसीना कम हो जाएगा, फिर आप मैग्नेट लगा दीजिए।
ठीक है सर। थैंक यू जी।
जी भाई
थैंक यू सर।
जी। जी अलका जी, अलका वर्मा जी।
में ठीक होगा? अगर किसी को डेफिशिएंसी है तो ये पॉइंट प्रोटोकॉल कब तक इस्तेमाल करना पड़ेगा?
कौन सी डेफिशिएंसी? स्प्लीन की?
स्प्लीन की हाँ
आप उसको अगर पहले आप उसे 12 दिन ट्रीटमेंट दीजिए, एक एक दिन
जी
छोड़ के। अगर पेशेंट आपके घर के पास में रहता है
जी
तो रोज मत दीजिए, एक दिन छोड़ के दीजिए। आज दिया फिर एक दिन गैप किया फिर एक दिन, तो एक महीने में 12 ट्रीटमेंट हो गए,
जी
है ना। मतलब 25 दिन में 12 ट्रीटमेंट हो गए। फिर उसे पूरा 7 दिन पूरा ब्रेक कर दीजिए, राइट।
जी
तो अगर छोटी मोटी प्रॉब्लम है, जैसे किसी को सिर्फ डाइजेशन की गड़बड़ी है, किसी को, तो एक 12 सीटिंग में ठीक हो जाएगी। लेकिन प्रॉब्लम बड़ी है तो आपको 12-12 सीटिंग के कम से कम 3 से 4 महीने से ट्रीटमेंट देना। अब मान लो किसी को वेरिकोज वेन है, तो वेरिकोज वेन को तो ज्यादा समय लगेगा, 5-6 महीने लगेंगे, राइट?
जी जी
तो उसे हर महीने 12-12 ट्रीटमेंट दीजिए। 12 संभव नहीं हो तो 7 से 8 ट्रीटमेंट दीजिए। अगर आप निडल करते हैं तो कम ट्रीटमेंट में भी काम चल जाएगा। आपने अगर 7-8 ट्रीटमेंट दिए तो काम चल जाएगा, लेकिन अगर आप मैग्नेट लगाते हैं तो 12 से 14 ट्रीटमेंट दीजिए कम से कम, है ना? तो इस तरह से प्रोटोकॉल का निर्माण करिए। कितना ट्रीटमेंट देना ये इस बात के ऊपर डिपेंड करेगा कि बीमारी कितनी रूटेड है, कितनी गहरी है ना, उसके ऊपर डिपेंड करेगा।
थैंक यू।
जी वेलकम। यस अंजलि जी।
सर मेरी को एक चीज ये पूछी थी, वैक्सीन लगी थी कोविड वाली, तो उसके बाद मेरी राइट आई में सबसे ब्लीडिंग होने लगी, जिसकी वजह से ब्लीडिंग की वजह से वो बिल्कुल मतलब रीजन खत्म हो गया उसका, और डॉक्टर ने ऑपरेशन भी करे 2 बार, लेकिन 2 साल हो गए अभी तक मेरी आई में बर्निंग और मतलब रीजन नहीं।
जी
राइट
देखिए, ऐसा अक्सर होता है क्योंकि ये तो क्लियर है कि कोविड वायरस के कुछ साइड इफेक्ट हैं कई लोगों पर, और कोविड ही नहीं किसी भी वैक्सीन के साइड इफेक्ट होते हैं। कोई बात नहीं, आपकी अगर आंख से ब्लीडिंग हुई है ना, तो इसका मतलब है
अभी भी हो रही है, मतलब वो इंटरनल ब्लीडिंग अभी भी हो रही है, जिससे वो डार्क।
समझ गया। तो क्या हुआ कि इसमें लिवर एग्रेसिव हुआ है और लिवर ने आक्रमण किया है ना? तो
हाँ।
लिवर की एग्रेसिवनेस को घटाइए। लिवर की एग्रेसिवनेस को कैसे घटाएंगे? उसके सन और ग्रांड सन पॉइंट को सेडेट करेंगे, लिवर 2 लिवर 3 सेडेशन, और भी कुछ पॉइंट लिवर के सेडेट कर सकते हैं, जिससे लिवर 13 लिवर 14 सेडेशन, और गॉल ब्लैडर 34 को भी सेडेट कर सकते हैं। इसमें जो सबसे बेहतरीन पॉइंट है वो है लिवर 2। सबसे जो, अगर आप बोले नहीं एक ही पॉइंट बताइए, इतने पॉइंट नहीं कर सकते, तो मैं बताऊंगा लिवर 2 सेडेशन, जो आंखों का सबसे बेहतरीन पॉइंट है। तो आप लिवर या तो 4-5 पॉइंट सेडेट कर दीजिए। अच्छा, ये आपको सेडेट करने होंगे क्योंकि लिवर हीट ही आंखों में ब्लीडिंग पैदा करती है, राइट? लिवर हीट, लिवर हीट कहते हैं कि इसे कहते हैं लिवर विंड राइजिंग द लिवर फायर एंड क्रिएटिंग द ब्लीडिंग। मैं फिर से रिपीट करूंगा, लिवर विंड राइजिंग द लिवर फायर एंड क्रिएटिंग द ब्लीडिंग। कभी आंखों से ब्लीडिंग होती है, कभी नाक से ब्लीडिंग होती है, कभी अलग अलग बॉडी पार्ट से ब्लीडिंग होती है। कारण है लिवर विंड राइजिंग द लिवर फायर। इसका प्रोटोकॉल हमने डिस्कशन किया था अपने एडवांस टीसीएम की क्लास में, शायद लिवर के डिस्कशन के समय, कि लिवर विंड राइजिंग द लिवर फायर। तो बस लिवर फायर को सेलेक्ट करिए। और जो एडवांस टीसीएम वाले लोग हैं वो नोट्स को पलट के देखिएगा, लिवर वाले चैप्टर में हमने डिस्कशन किया इसका। गॉट इट? लिवर को शांत करिए। लिवर, हाँ,
डेली करना पड़ता है और डेली जनरेट हो जाती है, कैसे मतलब वो कम कैसे, मतलब ठंडक कैसे होगी?
हाँ मैं आपको भी बता रहा हूँ कि लिवर ही की गर्मी शांत करेंगे तो वो ठंडा हो जाएगा। देखिए, आंखों में जो गर्मी होती है वो लिवर से होती है। आंखें पीली होती हैं अगर जॉन्डिस होता है, आंखें लाल होती हैं अगर व्यक्ति गुस्सा होता है, आंखों से ब्लीडिंग होती है अगर लिवर में गर्मी बढ़ती है। क्योंकि लिवर का अगर आप रास्ता देखोगे तो लिवर का रास्ता आंखों से होके जाता है। मैंने आपको शायद रूट दिखाया था,
हाँ दिखाया था
दिखा
सर,
ना?
दिखाया था। हाँ।
तो लिवर में गर्मी बढ़ेगी तो वो आंखों में दिखेगी। तो लिवर को शांत करिए, लिवर को सेडेट करिए। लिवर 2, अगर आपको 4 पॉइंट लगाने हैं तो लिवर 2-3 सेडेशन।
सर मैं तो 2 साल से लगा रही हूँ मैग्नेट से,
कहाँ
और
लगा?
अभी भी मैं धूप में नहीं निकल पा रही,
कौन से
मतलब
पॉइंट?
धूप में निकलती हूँ। लिवर 2, 3, गॉल ब्लैडर 16 और गॉल ब्लैडर 20 और गवर्निंग वेसल 16, LI 11।
ओके, और पॉइंट लगाने होंगे। जैसे मैंने आपको बोला, लिवर को पूरा शांत करिए। लिवर 13, लिवर 14, गॉल ब्लैडर 34, है ना? लिवर को और शांत करिए। इसमें देखिए लिवर विंड राइजिंग द लिवर फायर, है ना? अच्छा, अब एक दूसरा ये है कि लिवर विंड बढ़ रही है और लिवर विंड बढ़कर लिवर फायर को बढ़ा रही है, राइट? तो दूसरी एक तरफ ये करिए, थोड़ा सा किडनी को मजबूत कर दीजिए। किडनी को कैसे मजबूत करिए? थोड़ा सा किडनी 6 और स्प्लीन 6 पॉइंट लगाकर थोड़ा यिन को भी बढ़ाइए। किडनी 6 और स्प्लीन 6। हमारे किडनी का फॉर्मूला, यिन का फॉर्मूला है 6
हाँ
6
4
6 6
6
फॉर्मूला।
6 हाँ हाँ
किडनी 6, स्प्लीन 6, पेरिकार्डियम 6 एंड हार्ट 6। तो वीक में कम से कम 1 या 2 बार इस प्रोटोकॉल को लगाइए और बाकी इसे आप आजमाइए, ठीक है? इतना करिए।
ओके थैंक
तो चलिए आज की क्लास को यहाँ पर विराम देना होगा, है ना, बिकॉज इट्स ऑलरेडी 10:40, राइट? बाकी डिस्कशन हम अभी अगली क्लास में करेंगे। सो लेट्स क्लोज द सेशन नाउ। आज की क्लास को यहाँ पर विराम देते हैं, अब हम मिलेंगे अगली क्लास में। थैंक यू सो मच, गुड नाइट।